If you enjoy this content, please take a moment to rate and review it. Your feedback will greatly impact our ability to reach more people. Thank you.
Okay, welcome to Health Further. We have a guest host, Paul Kappelman, on. Marcus is in places unknown, traveling around the world, but we have a great guest host. Paul, thanks for doing this. Maybe the third or fourth time. You've done this a few times.
Absolutely. It's been a while, but I'm happy to do it again. Yeah. So thanks for the call. Yeah. Happy to fill in from.
I think the beard is new since the last time, so your fans will notice new beard.
I know.
But give the audience a little bit of your background. An operator for a lot of years, and then now doing private equity backed things. But
yeah, absolutely. So, most recent operating job was I was the CEO at Ovation Fertility, nationwide platform of fertility clinics owned by Morgan Stanley Capital Partners. So I'll come back to Morgan Stanley Capital Partners because that's who I'm working with a lot today. But prior to my Ovation experience, it was really almost 30 years in health systems. I started my career early on in Louisiana with HCA. And then worked for Triad out in Arizona. I was lucky enough to be in Arizona for 12 years, which when you're, a hospital CEO, you bounce around a lot.
That's a long time in one place. Yeah.
We grew the system pretty tremendously there. Really innovators in the outpatient footprint. We're doing ambulatory stuff well before many others were doing in the urgent care space, full-scale ambulatory, built a new hospital out there. And anyways, great run out in Tucson, Arizona. Loved it. Both my girls were born there, so it's a special place. Then I went to work for a startup company that was doing joint ventures with not-for-profit hospitals. It was the former execs of Triad called LHP. I was the president of LHP, kind of ran operations, ran the home office. And then as we were entering in our sale process, I stepped in the interim CEO role, knowing that we were going to sell to what was eventually Ardent in Nashville. So that's how I got to Nashville. David Vandewater convinced me to move. Always knew I'd get there. We worked together. He loved the JV strategy. And I joined as the chief operating officer responsible for our portfolio. And we did two really huge deals. After I joined, we did a partnership with the University of Texas and one with the University of Kansas. And by the time I left, the company was bordering on $5 billion in revenue. And that's when I transitioned out. Wasn't going to move again. So the way to stay in Nashville was find that private equity-backed healthcare company, and that was Ovation. And since then, I've been doing operating advisor work.
Ovation was a big win.
Ovation was a great outcome. We sold to U.S. Fertility, which was a strategic, and they just actually sold again, which is great. And I've been doing operating advisor work for Morgan Stanley Capital Partners. I sit on two boards for them. One is Prescott's, a clinical engineering company, does microscopes, pumps, monitors, anesthesia machines, sterilizers. And the other one's called SpendMend. And SpendMend, without getting a lot of detail, does cost recovery for health systems, non-labor spend. I grew up in the audit recovery, profit recovery, but has since added a pharmacy tool, a purchase services tool. They do tax, rebates, 340B, a lot of different things to partner with health systems. So I'm excited about helping them as well, and we'll be joining that company's board as well. And then I've got some other private equity firms that I do project by project, helping them look at different sectors, helping them look at companies, and in discussions on maybe one more board role and maybe a different kind of space, sort of broadening my exposure. So anyway, excited to be here. I listened to the show and enjoyed it.
A lot of knowledge in, there's a lot of experience in operations. You bring much more depth than either Marcus or I in hospital operations or private operations, definitely. So it'd be great to, as we go along, I want to hear a lot going on in the world. We'll touch on the different themes as we touch on the story.
Is there a lot going on? I haven't noticed.
Yeah. Okay, so the economy. So inflation, we got the inflation for December this year in the Wall Street Journal. Consumer prices were up 2.7%. That was steady from November. So not to the goal of 2%, but holding below 3%, I think is pretty good. What are your thoughts about inflation?
Yeah, I think given some of, our early concerns about the impact on tariffs, it's positive to really understand that a lot of that stuff has flowed through and we've managed to keep it under 3%. Seems positive. I'm relatively optimistic. We know that people still aren't feeling it quite the way they want to and need to on a lot of prices, but hey, it's better than going the other direction, and at least
Yeah.
it's holding steady.
Yeah, I mean, disinflation, meaning it's coming down from when it was 6, 7, 8%. That's a good thing, but it's not making prices go down. They're just going up less quickly. So you still have that sort of concern about affordability. And this is part of it. So the next story also from the Wall Street Journal, America's job market has entered the slow lane. We have entered very few new jobs. You can see, if you're watching the video, which you should on YouTube, the chart is pretty telling here, where like every year since the pandemic, it's been fewer and fewer jobs, about 50,000 monthly average jobs added all of last year. So pretty slow job market.
Yeah, I didn't. It's hard to trust the numbers you guys have talked about in the past, and I completely agree. It's like, how do we really know? And so I'm not totally pessimistic on this, and I think the report talks about between Fed job cuts and the lack of Fed hiring and state hiring and immigration enforcement, still relatively low in point. I'm still optimistic. I think down to healthcare, you guys have mentioned it several times. Like, if it weren't for healthcare, it'd be even worse, which I think highlights the issue that in healthcare, recruitment and retention of staff is still in the top 3 issues on every CEO's scorecard.
Definitely. So I'm showing the kind of the breakout by industry right now. And yeah, you're right. Healthcare is by far the most jobs created. Plus, it's hard to tell in the graph, but probably 3.5%, almost 4% up. And utilities, and then leisure and hospitality. Those are the other sort of trailing ones. But there's obviously the federal government cut a lot of jobs. So overall, it was not a great year. But healthcare is the one.
How do you feel like in your gut about the jobs market? Because it's hard to really understand the data or trust in the data, just given the shutdown and just the corrections being so huge. What's your view on how do you feel about the job market?
Yeah, I kind of think it's going to be a bifurcated job market. I think that AI is going to lead to more opportunity, not less. A lot of people are scared of AI. I'm pretty bullish that it's going to help the economy get better. And if you're willing to learn new roles, new functions, I think there's a lot of opportunity for like our kids. I mean, you have 2 daughters, I have 2 sons, both kind of, maybe you have one right out of college, but trying to figure out where they're going to be. I think there's a lot of opportunity if you're curious and you're willing to learn things. But you have to have that curiosity, that willing to learn new things, because everything's changing so quickly.
Yeah, I agree.
That's my guess. Okay, the next story, home sales. Home sales in December jumped 5.1%, biggest gain in 2 years. So a lot of home sales closed at the end of the year. I think it was sort of a combination of interest rates are down a little bit, and it's been just sort of pent up with very low sales for almost all of 25.
And prices have moderated reasonably. So I think what it shows is even a small reduction in interest rates has a pretty positive effect. So what does that mean going forward? If we see a significant change next year to the positive and interest rates go down, 50 basis points or 100 basis points, like that could have a meaningful impact on home sales. That's what I took out of it.
Yeah. Well, we're going to get a new Fed chair
in May.
May or June. I think. Maybe it's June. And I think the only thing I'm confident about is that Trump's going to pick someone that between now and the end of his term is definitely going to be very dovish and reducing rates. Or at least we'll talk about that in the interviews. Otherwise, they won't get picked.
Yeah, maybe we'll have a new Fed chair. I've heard these crazy stuff that if we can't confirm somebody, then what do you do? It's just Powell. Just Powell stay in there. I don't think he wants to. So I don't know what happens. Yeah. It's only happened like twice other times in history where a new Fed chair doesn't get confirmed, and all it takes is some defectors on the Republican side, which I think they're pretty. There's some people pretty upset about that stuff. That's another story, but
well, I hope. Just no Fed chair, I think would be really bad. So hopefully DC is dysfunctional, but maybe they'll get their act together to do something. We'll see. Okay, so that is the economy. I think in general, pretty good for the start of the year. We'll see how it evolves. But
Yeah, I am optimistic. Obviously, I'm on the side of the K that has done well, and I admit that. But just trying to be observant about where we're going. If we can see, some prices, some dollars at the pump, and unemployment, stay where it is or improve, jobs improve a little bit. I feel optimistic about where we're headed. Maybe I'm just overly optimistic in general.
I don't know. I think it's pretty good right now. So, okay, moving into venture. So we have one deal and then a summary story. So this startup is going to bring cancer treatment to the home. So infusion therapy, it's Luminate Medical. They raised $21 million. They're in Ireland, and they're going to bring their services to the U.S., where they sort of allow cancer patients to do the treatments at home. What do you think about this?
Yeah, I think there are some others. I think we even have some based in Nashville that are doing this similar things.
And
And
IVX is a friend of the Claude, Gertner, and those guys. I don't know.
They're not doing any home
more
stuff.
Than just cancer. They do lots of, and it's in the neighborhood. I don't know how much at home they have.
Does IVX? Yeah, I don't know if they do it at home, but there's another Nashville firm that's doing it. And infusion in general. Listen, I think it's great. I think it's hard for anyone to argue that if you can get your healthcare at home, you would absolutely prefer that than going into a center, even some of the nicest centers. I mean, for many reasons. So then you ask the question, like, why hasn't this taken off at a pace? Like, it's not that difficult to do, right? I mean, we clearly have infusion being done in the home, so why not the cancer infusion? And I think the barriers, we got to talk about what the barriers are. The barriers are the finances, the economics. Like, they're getting paid less than the health systems, and it's hard for them to drive down the drug prices because they don't have the scale of buying as many others do. The big cancer platforms or hospitals and health systems, they don't have access to 340B, which brings it down. So it makes the margins tighter. And I think they have to be very careful on patient selection. I think as technology gets better with remote monitoring and video, that they can be a little more risk tolerant on the type of patients they have there. But you got to be careful, right? Because the patient, these are sick patients, and if they go down where they're by themselves, or they have a tech or an aide, and maybe not a nurse. And if it's a nurse, it doesn't make economic sense, right? If they're going to be monitored by a nurse, the nurse might as well have more than one patient.
Yeah, I agree. I think suitability is a question, but I think where you started is where I think is the real thing, which is just the structure of how the reimbursement functions. Is that if you are infusing in the health system, you get paid more, and they have a lower cost for the drugs.
That's right.
And their labor cost is lower because they can treat multiple patients with one nurse.
That's right.
And then it's much more convenient for the patient, but the reimbursement is typically lower to do the at home. And then, especially in cancer, I think one of the reasons cancer has been slower than some of the other autoimmune diseases where you need infusion as well is that drugs are changing a lot and therefore really costly. And so it's really difficult to make the math work.
And patients generally are sicker, right? I mean, there's plenty of autoimmune patients getting infusions and they're otherwise healthy and their autoimmune disease is in remission, right? But they're healthy patients.
Right.
The cancer patients tend to be sicker. They tend to be riskier, and the drugs tend to have more side effects, and sometimes immediate side effects. So I think it's really interesting, and I'm excited about it, but I think they got to address some of those challenges before it takes off to the level in which we see a lot more patients getting their treatment at home.
Yeah. Okay. And then Rock Health, which we're friends of Jumpstart out in San Francisco, they do a good annual summary of the digital health markets. And they had a ton of data in here. We'll put the link in the show notes. But 2025, tale of two markets. And so they're basically saying that there are the haves and have-nots in digital health. And the haves are, backed by one of a very few VCs. And those VCs, Andreessen Horowitz, General Catalyst, Conley Perkins, they've all done at least 5, maybe more than 5, what they call mega deals, which are huge size deals, and largely in AI. And then all the rest of digital health is pretty quiet and is in the have-not, kind of stuck in what they call the murky middle. So I don't know. What do you think of this summary?
Yeah, I thought those were I thought it was good. I thought those were the two takeaways. And then they called like the gigantor companies, can they be successful? The big players that have not traditionally been in healthcare, tried to get into healthcare, failed miserably, right? You think of how many sort of times that Amazon, Walmart, Walgreens, they all, and they, can AI be the difference? And it sort of dovetails into the companies that got the big rounds were AI and or funded by, the gigantors. Can these other companies be successful in getting into healthcare? Is AI the difference maker to make them successful? Because they haven't been up to this point.
Yeah, like that's the question. I'm biased because I'm not a mega VC, so I have my own thoughts, but we'll see. They have a lot of money back in them. Okay, moving into policy. Good story. You found this story in Beckers Hospital Review. CMS published the healthcare spending for 2024. I guess it's a year in arrears.
Yep.
And
it didn't get better in 25. We know that. I don't know what it is, but it didn't get better.
We as a country spent $5.3 trillion, which is a 7.2% increase over the year earlier, 2023. Just huge numbers. So what are your thoughts about the massive spending there?
Yeah, we're talking about inflation at 2.7, right? And then we're looking at this being a 7.2% increase. And the buckets, it's just huge numbers. And, there's nothing that I've seen in my sites that give me confidence that's going to slow down. We don't have policy, and we'll get to that. Some of Trump's ideas, I think, so one's good, maybe one doesn't make a lot of difference in my opinion, but none of which are really going to bend the curve, right? He talks about drug costs, hugely important. It can be impactful. It's 10% of it, right?
Yeah, right. That's what I was just going to say. Like it's depressing how much money is spent, but it's pretty insightful where they break down the by type. So hospital care, 31%. Physician and clinical services, 21%. So 52% is hospitals and physicians and clinic. Retail prescription drug, 9%. So it is valuable to reduce the spending on medications, but the real thing you have to figure out is how do we spend less on the actual providing care to people? And I don't see anything that's going to bring that down dramatically, right? It just costs a lot of money to deliver care.
No, it's just changing utilization patterns, changing behaviors and utilization patterns. And there's things that can be done. I'm just not sure any of them made their way through Washington yet. So,
right. Yeah. Okay. And then, as you said, today, Trump came out with the Great Healthcare Plan. And then he had a 6-minute video talking about his plans. We've both watched it. I'm not going to put it, we'll put the link in the show notes, but what do you think about his announcement? I mean, it's sort of lower drug prices, lower insurance premiums, and then price transparency, and we'll send you a bunch of money. Yes. I don't know how any of it's going to work. But
yeah, so let's break it down. The send you a bunch of money, like, I don't understand how that changes the cost pattern we just talked about, right? So I understand his rationale for doing it, which is rather than having a subsidy that brings the premium down, the insurance companies get paid, he's going to give the money to you, you choose it. But that doesn't reduce healthcare costs, and it doesn't change premiums, right? The insurance companies are going to jack premiums up and able to do that. So if you have more money, that's great, but your premiums are going up faster than the money. So is it a good thing? Maybe, but it's not going to have a big impact. The drugs, I do think, will have a real impact. And if he can execute on most favored nation and bring what we're paying down and negotiate with Medicare and Medicaid using the buying power, bring costs down for everybody, both in the retail setting and the hospital setting, that will have an impact. We talked about it's 10%. That's just retail. So, I mean, there is something that can be done there. If he could reduce what hospitals have to pay or the physicians have to pay for medications, then that could have a real impact, which then could drive, you could reduce Medicare spending and Medicare reimbursement, and the hospitals would be net neutral. So that's a positive. Transparency, it's a good thing. total failure so far is its impact on quality outcomes. Patients don't understand it. So yes, it's a good thing. It's hard to argue with, but to this date, it's been kind of a nothing burger.
Yeah. Yeah, I think I agree 100%. So I would point out, I mean, it is kind of around the edges to work on drug pricing, but it's very visible to the voting population. And I think, even though it's only 10%, 10% of 5.3 trillion is 500 billion. So, it's a decent amount of money. But it's not the big place where we spend money.
No, and he's right. Listen, there's no reason that we should go to our pharmacy and be paying 3 times what another human is paying for it in a country that's less advanced than we are. Right? It just doesn't make any sense, and that needs to be fixed. So I'm glad he's attacking that. I think it's a real opportunity, and it can put money back in people's pockets and reduce costs. Other than that, the rest of it, it's like, really, are we gonna? That's how we're gonna attack 5 trillion. It's just we gotta come up something that's bipartisan that really gets at utilization and change the dynamics and incentives of our system. And we'll talk about that a little bit as we get into some of the payer stories.
Okay, so Kennedy came out with new dietary guidelines. He inverted the food pyramid and wants you to double your protein and not eat very many grains. What do you think of this?
I think it's positive, right? I mean, I've been a long believer in cutting out processed foods probably since 2007 or so. I've modified my lifestyle and diet. Anybody who's done that knows it ain't cheap. I mean, it isn't. It is quite expensive. So I don't think this addressed it. But the fact that if we start off with this in our school system and get kids early changing their diets, I think I'm a personal believer it can make a huge difference in overall health and cost. Yeah. So I'm happy about this.
Yeah, I think it's a good thing. Changing people's behavior starts maybe with education. And that's what this really is. Kennedy has a big platform to talk about what people should be eating, whether they can afford all of these whole foods and, fresh fruit and vegetables. And then there's a lot of preparation that goes in. So you have to spend more money and spend time preparing it. There are some families that don't have the money or time.
That's right.
But I think it's a positive.
It's a step in the right direction. I agree.
Right. Okay, moving into payers. So UnitedHealth, the Senate, Chuck Grassley launched an investigation looking into UnitedHealthcare's aggressive tactics to boost Medicare Advantage payments. I don't think anyone that I know of is very surprised that UnitedHealth Group has been looking to, if you're at United, accurately reflect all of the risks in their population. And if you're at another place paying United, saying sort of artificially inflating it, that's been going on for a long time, but the Senate's researching it.
Yeah, this and the Kaiser story we'll get to later. So I think if you were to think about providers and payers overall and do a true audit, they tend to undercode more than they overcode, right? Or add risk factors. So if they're not putting in systems and processes and people to make sure that things are getting documented appropriately, coded appropriately to show the patient's severity, then they're going to be leaving a lot of money on the table. That's the game. And the question is, when did they step over the line? And, did they step over the line? I think the bigger, more important question is, how do we change the game? How do we change the incentives so that we're incentivizing for good quality, good outcomes, and keeping people healthy and reducing costs, not just documenting what you're doing? It's never fully made sense to me, but it's important in the provider world, and it's really important in the payer world that you document severity accurately.
Yeah. So let's jump to the Kaiser story, because I agree it's almost identical. Right. But it's a settlement. So Kaiser settled for $556 million to settle their Medicare Advantage fraud. There were 2 whistleblowers that reported what was going on, a medical coder and a doctor, and they talked about coding parties and the stress to, make sure you code things properly. As you say, that's not uncommon. I think that's very common, and it needs to be done if you're going to get it right. Certainly can go too far. But this is the biggest settlement that they've ever had, I think.
Did this sneak up on you? Were you aware that they were being investigated with this whistleblower suit? I was not.
I was not aware they were being investigated at all.
It's huge settlement. And if you remember there's been others, but the Tenet settlement was huge 3 or 4 years ago, but I was very aware with that, and they were in the media all the time through that settlement.
Yeah.
This one just kind of snuck up on me. I was not aware that it was going on.
Yeah, I was not either. It says in the story, Cigna had a similar settlement for $170 million.
That's big.
They don't have the Tenet in here, but
it's been a while.
It's probably something about it being a public company versus a nonprofit with disclosures. I bet there's more disclosures in Tenet or even Cigna.
You're probably right.
Okay, and then UnitedHealthcare also, Marcus and I talked about this last week, they've really been in the bullseye for politicians and even press to attack. And I think they're going to be that way for a while just because they're such a big company and there's lots to question with any payer. But they unveiled a pilot to accelerate payments for rural providers from 30 days to less than 15 days, which I think is positive. And I think, good, maybe olive branch for them to reach out and start paying people more quickly.
Yeah, good faith effort. They should be able to pay in 15 days for clean claims. There's, and these hospitals are so much more dependent on cash and don't have the balance sheet to float. And so, 15 days makes a huge difference for them.
Okay, moving into health systems. In New York City, 15,000 nurses went on strike. Marcus and I talked about this last week. It was pending last week. Now they've actually done it. This seems to happen once a year, once every few months. And the nurses typically, when they strike, they have a lot of negotiating power and they end up getting more pay or better hours or better work situations. I'm not sure the health systems have the money to pay that much more, but they're on strike. What are your thoughts about this?
Yeah, it's usually about two things: money and staffing ratios. The money is usually negotiated, and hard to say in this case, whether they're underpaid, overpaid, fairly paid. The staffing ratios is just always it's always a challenge because they put in these mandates. And the hospitals may have all the intent, but can't meet them because they can't find the people, or people call out and they're short staffed. They can't get agencies. So those are always troublesome. But I feel for these New York hospitals because, as you said, some of them are challenged. And given what's happened in New York City with the mayor, with Manami, I mean, he's not going to be a friend to these private institutions. And he will be a friend of labor. So if they're looking for any support, they're not going to get it. So likelihood that these guys are successful.
That's right. They're not. Yes, I think the hospitals are going to have to negotiate to get to some agreement.
They will
relatively quickly. Okay, and then Epic sued Health Gorilla around their health information network. I think this is an interesting story. Epic is obviously, huge. They probably have 50-60% market share in hospital EHRs. And they're alleging that Health Gorilla allowed tech firms to, get access to patient records. As a VC and interested in innovation, I think freeing up the information is something that we have to do. Now, maybe Epic should be able to they should be able to wet their beak, as you say in Italian mafia circles, but they should allow it to happen. So I don't know. What are your thoughts?
Well, there's two pieces to it. So I think one is easy and one is a little bit more complex, and we could debate it. So there's sort of the health information exchange portion of it, and Epic sharing data for clinical purposes and interoperability. And they've been much maligned for not being easy to work with outside of Epic, okay, and really holding that data. They've done work and improved on that and been forced to do it by some legislation. Okay, so these HIEs are usually regional organizations that share data. So if you're not on Epic, it's LabCorp, it's other physicians. They're combining that data so that providers and patients can see it in one place. The accusation here is they not only use that for patient sharing and clinical information, but they sold it to other companies to monetize it. I think for an HIE to do that is a no-no. Like, that's clearly against the mission of an HIE, and if it's true, they're gonna go down. Then there's the question of, should Epic be sharing all the data they have for reasons other than interoperability? that's probably an argument or a discussion debate for a different situation. Your view is, the more they can use this valuable data for innovation and clinical outcomes, they should. Their view is like, this is patient protected data. It's our health system's data. We don't have the right to share that for anything other than clinical outcomes. So it's an interesting topic. I think they'll win this case if they prove at all that this HI used it for any other reason than interoperability.
Yeah, I think it's going to be an ongoing debate over the next couple of years, because Epic's going to try to hold their dominant position, and a lot of people, me included, would say that the federal government subsidized the digitalization of medical records into electronic health records, and Epic benefited in the billions of dollars of subsidies for that.
That's a good point. That's a good point.
And they have a responsibility to allow sort of the market to continue to evolve. I think they should still have an important role to play, but just saying like we own all this data and no one can have it is, I think, going to be a little bit short-sighted. But I agree that Health Gorilla, if they agreed to not do something in the HIE, then and they violated that they will lose in that case.
The counter to your argument, and I tend to agree with you, but the counter to it is it's not their data, right? It's my data. It's the health system's data. It's their medical records. Epic is nothing more than the portal that sits on top of it. So that's what complicates it, because they don't really, quote unquote, own it.
Right. Well, yeah, I mean, I think patients should definitely be able to access it and move it. The data ownership and data portability is going to be an ongoing fight. I think.
And there needs to be a compromise, because there's too much we can do with the data to innovate for it to be sitting in a black hole. At the same time, I'm concerned about anybody having my data and what people will do with it who don't have the right motives, safeguards, et cetera. So it is something we're going to have to tackle for sure.
Okay, moving into pharma. So Boston Scientific bought thrombectomy specialist Penumbra for $14.5 billion this week. So I didn't know this company, but great to see this deal. It's a good size deal to start the year. Announced at JP Morgan. What do you think of this?
$14.5 billion. That's a big deal. That's good, and I think more of these that we see is positive, because it's sort of a graduation for them. And to me, that's positive for deal making, but it's also positive for innovation. As these companies, smaller companies, it's not small in the valuation, but sort of smaller startup to do one thing, that get bought by Boston Scientific, it promotes the next company to go out and try to find this. And I think that's
right.
Great.
It gives an example that 1,000 startups can look at and work all day, all night for little pay and a lot of effort to try to create something new and really impactful. And when they do, it's good to see them have success like that. So, okay, about health and us. So this is from the Wall Street Journal. The flu is surging and how antivirals can help. So two aspects of this. First of all, the flu. I'm sure many of the listeners are experiencing it. It's been a really bad year for the flu in two ways. It's a lot of pretty severe flu, and the vaccine has not been very effective. I think most people are living that and kind of know it. But then the antivirals and how they help is pretty interesting, and there's a few new ones. So maybe talk about just this story. What are your thoughts about?
Yeah, the flu's bad, and for we've all known people that have it. I'm knock on wood, I haven't. I hope you haven't either. But it lingers, man. It just never goes away. They 28, 30 days later, they're still dealing with it. So yeah, so some new antivirals that they talk about in here. I think that's good, because we all think about Tamiflu as sort of the only recourse. So really positive that there's some other alternatives that have results. Two, I think it's hard to tell whether there's more of it or we're just testing it, because the at-home tests, people use them for flu and COVID. They've sort of gotten that into it so they can test at home. So that gives more of it, which I think is a good thing, because these antivirals only work if you hit them within the first 48 hours. And then what I don't think about a lot, and I don't think a lot of us think about a lot, is you can sort of use them prophylactically, and it talks about that, meaning that you sort of get the sniffles, or your spouse or friend had it, you were around them, maybe you should take them and nip them in the bud early, and it has some promising results of shortening, lessening, et cetera.
Yeah. There's not. I mean, it costs $50 or so, $100, but there's not a lot of downside other than that if you have that money to spend to sort of prophylactically protect yourself. So, because if you take it too late and you've had the flu for more than 48 hours, it's not really very effective.
And I don't think the new ones, when I read that, my quick read was, I don't think the new ones have changed that. They still sort of have that limitation.
Yeah. Okay, moving on to Web3 and crypto. Polymarket, which is one of these betting markets, prediction markets, they signed an information deal with Dow Jones, owner of the Wall Street Journal. And then, of course, Dow Jones, Wall Street Journal broke the story. They partnered to display their data inside the Wall Street Journal content. So this is pretty interesting. We think about it as another place to gamble,
Right.
But really they're better served for information. It's that wisdom of the crowd thing. People were complaining about someone made a ton of money by betting in Polymarket or one of them, Kelshi, about what, would we invade Venezuela or not? Obviously, if someone at DoD that had some inside information, that's the whole point of decision prediction markets, is people do have different information, and they then can put money behind it. What do you thought about this story?
Yeah, I thought exactly the same thing, Beck. It's like, oh my gosh, is this increased sort of ease of and visibility of gambling a good thing for us? Probably not. But on the other end of it, like how good has Vegas been over the years on predicting outcomes and having more data, more things that we have good accuracy is a positive. So it's kind of a mixed bag in my opinion.
Yeah, I'm excited to see it in the Wall Street Journal, because if there's better information, that's a positive thing that I can benefit from versus the
I guess how do you and I get this on our phones so we can see sort of what's happening? I didn't quite understand.
Yeah, I think the Wall Street Journal is going to have, in an article, it'll have the
top 25.
Senator Grassley is investigating United, and prediction markets say that it's likely that he doesn't find anything, or whatever. It does find anything.
It'll be interesting to see how this rolls out.
Okay, then jumping into AI. So we had last week, OpenAI launched their health dedicated product, and then this week Anthropic said it launched, maybe in competition, maybe they were doing it already, Claude for healthcare. And it is similar in that there's a kind of HIPAA protected segment that's designed for, they started in life sciences, now they're brought into healthcare. What did you think about this?
Well, we know there's a demand for it, right? There is absolutely a desire for people to use it, and it's powerful. I think all of us trust Anthropic more than we trust OpenAI. So hopefully it's as good. I haven't even looked at it yet, but it's going to get utilized, and there's so much that we need to learn. You just can't get in a 30-minute doctor's, whether it's a new diagnosis, and having good information is just power.
I was trying to figure out, how good is it, and found on X an individual that took took their MRI scan data, and he got it in a USB, memory stick, and inserted it into his laptop and asked Claude Health to analyze it for him. And got the full image. And there were a couple more prompts that actually focused in on where there was a bulging disc or whatever he was getting looked at. I don't know if this is good or bad, but that wasn't really what I wanted you to comment on. It is sort of going to unleash all of these people. It used to be that Dr. Google would sort of help people understand that they'd bring it into their doctor. This is going to be that exponentially more.
Yeah, there was always the discussion. I recall obviously working closely with doctors and hospitals when the Dr. Google thing came out and how many people complained about it. And it was like, there's no time to complain about it. It is there.
Right.
We're living in it. So you're not going to stop it. The question is, how do you use it in a productive relationship? I tend to think knowledge is power. Even if you get some things that maybe aren't perfect, them understanding their diagnosis, to me in the long run, is better than being totally ignorant, which so many patients have been for so long. So I'm in favor of it. Now clearly it's going to have guardrails and people got to speak with their physicians, but the more information they have about their diagnosis is better. They will have better outcomes.
I think in general that's true. Okay, then OpenAI acquired a healthcare startup called Torch to continue to sort of build out their healthcare platform. I didn't know Torch before this story, but I think that it sort of helps pull in data from a bunch of different sources.
Yeah, it kind of gets back to that HIE that we were talking about, right? I mean, so much money was invested in HIE, and the question is these big guys with their agents, like, is that even going to be necessary? They're just going to do it for you from here on out. Like, you're going to be able to pour it all in there. They're going to pull it all. AI will be the difference on maybe why the business model truly works versus all the things that we've tried to pull all the healthcare data before, and it's either not work really well or you can't monetize it. This may be the answer.
Yeah, well, certainly it worked well for the founders of Torch.
Right, exactly.
It's about a year old, and they built the framework of an HIE, but not in the sort of regional quasi-government, let's all sing Kumbaya and hold hands and figure this out for the good of everyone. They just sort of did it from a technical point of view and allow individuals to pull their data in. And then they got bought for about $100 million.
You and I talked about this about a year ago. We were talking about a company that was focusing on this. Today in Nashville, Tennessee, if I go to Quest and I go to Vandy and I go to a doctor who's a Centennial doc or there is no central repository. They have no idea. Like, the sharing of information is a total disaster, and that is in today's age. So if this helps that. And part of the reason why is because there hasn't been a business model to fund doing all that work and pulling it all together. Some of the HIEs do it, but they're funded by, they're sort of not making money. So maybe this is the answer: is the OpenAIs of the world can do this in a much cheaper fashion effectively. We'll see.
Yeah,
it's a problem. It's a real problem.
Right. Yes. Okay, and then Apple did a multi-year licensing deal with Google for Google's LLM called Gemini to power Siri and all the Apple Intelligence stuff. I think it's $1 billion a year for them to let Apple use their technology, but it's going to have the Siri brand still and still be Apple Intelligence. I think it's about time. Apple's so far behind.
Right.
What did you think about this story?
Yeah, I just couldn't agree more. Right. First of all, it's great news for both companies. I think it's big for them, for the news. So, but besides that, if you're a user of any of the agents, if you use ChatGPT or Claude and you're having conversations and they're doing stuff for you and then you go to use Siri, it's like Siri's just awful. I mean, it just doesn't do it. Maybe can make a phone call.
Yeah, without the frame of reference 2 years ago, it was still awful, but you didn't really know anything else. Right. So people dealt with it. But,
and I think what is the future of the phone, right? Think about if you really build in AI there that it has access to your apps. It's both exciting and scary that what it could do for you, and you might not even need a phone. All we may need is this earbud or glasses or who knows.
Yeah, I agree. I think it's good for both companies. Google is not going to get to train on all the user data, which is good for Apple users. And so that's also good for competition, because if they got that and all the Google assets, it might have been kind of game over. So
we've covered a lot, and under policy. We got one final story. Sorry, go for it. This is out of my league, so that's why I turned it out.
Okay,
this is big territory here.
So Anthropic released a thing called Cowork, which is an agent that can do work for you without you monitoring it. So you kind of ask it to do something. Ask it to write a blog post, or ask it to, please read my inbox and create drafts for 20 emails. Don't send it, just put it in my drafts and then I'll review them. I've been testing it. It's pretty good. It's not as good as the number one agent, which I use, which is Manus, but it's strong and it's much more trusted than Manus, which is a Singaporean company that got bought by Meta.
So is it focused on coding, or is it a general agent that can do the tasks?
It's a general agent. I pulled up a user on X. He was reported. So it just dropped on the 12th, Monday. And so he posted very quickly the first one. He spent 2 hours on it, and he was doing all business related functions. And that's what I've been using it for too. It's not a coding tool.
Okay.
And so this guy, in 2 hours, he wrote, I think he must be a search guy, a headhunter. He wrote 14 job descriptions, did a marketing strategy, sent 47 emails, did website copy for 3 announcements, brand voice guide, and responded to 23 LinkedIn messages. He claims about 2 months of work in 2 hours. That's my experience too. It's very good, and it connects to all your systems. And not everyone would trust Anthropic, but I trust Anthropic, and it hasn't done anything bad so far.
Well, that's what I was kind of thinking about with the whole Gemini Apple, right? We have all of our stuff in our phones or in our Macs. Will we get to this level, and hopefully you can choose how it integrates, like to your email, to your other apps. I mean, we're on 1 million apps a day. It'd be great if there was an agent who could assist us in doing that.
Yeah, that's right. I think over time, it already can do that. We don't know how to use it very effectively today. So I think over the next 12 to 18 months, there's going to be a lot of what's called agents, which just means it's an AI that has access to a browser and an email and what technologists would call tools, what you and I call applications, and it can do things. It uses those tools to go do work for you.
It's exciting and scary at the same time, just because of the amount of data it has access to, right? Like once you open up that Pandora's box, like that's so I just hope it goes.
I mean, I started with a Chinese/Singapore company, so I had to be really careful what I put in that. But I've been using that for like competitive analysis. I'm going to invest in this company. Can you show me all of the companies that compete with it? And it's not. There's nothing sensitive about that. It's publicly available, but it's just organizing it.
But it's not getting into your email, into your other applications that
right.
you use. Think about all the apps
you use. Have that.
Yeah, all the applications you use on a daily basis. Now, the efficiency gained if you had a tool that could help you manage all those without having to go in them. But it's also scary because the amount of data that you're then dropping in there. But it's coming. I mean, that's what's going to come. Good. Well, listen, we talked about a lot.
Yeah. So what's the policy? It sounds like you have a policy.
Yeah. I just think, it's hard not to like the one thing we didn't talk about, and it's been in your stories with just the healthcare subsidies, and sort of in the Trump, I'm going to pay it to you versus paying it in subsidies. The premiums are just like unbelievable. Like, so, I give you an example. So we have the subsidies piece. So those that were able to afford healthcare insurance on the exchange because they were a subsidy, like they're gone. We know they're going to roll off. That has a huge impact through the system. The second piece of it is those people who didn't get subsidies. Like I did not get a subsidy. I'm on the healthcare exchange in Tennessee. My premium went from $900 to $1,400. Okay. The employers their premiums are going up 6.5% to 7%, the largest increase in 15 years. Like this is not good for the industry. So I've said this for a long time, but it's just like there's got to be a day of reckoning where how do individuals afford it, and what happens when we absolutely can't. So I think there's going to be, the point being is there's going to be more of a negative effect than just the people who got the subsidies, because employers can't afford it. They're changing coverage. They're changing benefits, putting more on the employee, the patient. Okay. Or they're dropping coverage. Employees just don't sign up at all because they can't afford their portion of it, right? Their 25% of it still is unaffordable. The markets, like all these are hugely negative factors that have to be addressed. And we went backwards in going into 2026 in that. And that's scary to me. So I don't want to end it on a negative note,
no
but
question.
it's like a tidal wave that's coming.
Well, I mean, just at the highest level, what happens when prices go up by 40% like that? I think that two types of people don't get coverage anymore. They decide not to buy it. Either the people that can't afford it or the people that are healthy. Right? So people that can't afford it, they're still going to go get treatment. They're just going to do it in sort of an unfunded emergency department, right, or they're going to wait for. It's going to cost more, and it's going to go through the systems that it's going to put a lot of pressure on the healthcare systems today, where they don't have much capacity to take much more pressure. And then you have the healthy people that say, I either don't need coverage at all, or I'm going to go down to a bronze plan, or I'm going to go down to some catastrophic plan. Yep. And then the healthy people systematically come out of the risk pool. So now next year, it's going to be even worse, right? You get in this kind of spiral of bad underwriting trends. And the only way to change it is to pool risk differently. And that's a big thing to take on that I don't know how we would go about that. I mean, employers have tried to do one-off things, but they can't get enough critical mass, so far at least, to really do that much.
I think it might be interesting one time, obviously Marcus is a visionary and has it, for get some people around the table and say, like, how do we fix this? Because we're in a spiral. And you used to think about people who were uninsured as the poor. We just did. That was kind of and sort of sometimes the working poor, right? They were in the bubble. They were making enough money. They didn't qualify for Medicaid, but not enough to have insurance. And they were in the, it's the middle class now. I mean, you think about that check, $1,500 a month. And that was just, by the way, that was me as an individual. That was not my family.
Right.
That was one person. That was not my family. It was just me. All right. So call it $2,000 a month, $24,000. Now you're tapping into the people who can't afford that are squarely in the middle class. So
yeah, that is an issue. The harder issue is that the co-insurance keeps ratcheting up, and that's what bankrupts people, because the people don't understand co-insurance, and they have a car accident or they have something happen, and they now owe 25% of all the medical costs or whatever the co-insurance is.
Yeah, that's the employer's tool to keep premiums as low as possible. Is they change benefits, right? I've been there as a large employer. You tweak benefits, you tweak copays, co-insurance, and deductibles and other benefits to try to and it's not the wrong thing to do. You're trying to keep your costs, but you're also in it with the employee because the total cost, they're paying a portion of it. So you have no choice to do it, but you're right. It starts to get to the point where the deductibles, co-insurance, copays are high enough where that could turn somebody into bankruptcy. And in many cases, they might as well not have insurance.
Right.
All right. Well,
if you're going to be there's a lot of positives going on this week, but yes, we need to figure out how we're going to cover our population and how we're going to kind of maybe just stop the growth from 5.3 trillion. If we could hold it in the low 5 trillion, that would be a win.
Yeah, I want to come back someday and spitball with you guys. Like, all right, what do we do about it? Like, if we were sitting in Washington or giving advice to some of our friends who influence policy, like, what are some of the things we should be doing? I know you have your views.
I wrote a book just to wrestle with this issue because I think it's going to be a huge issue in the next 5 years where people are going to lose coverage where they don't have the ability to buy insurance that they can afford, and they're going to abandon and try to pool risk separately.
I agree.
And so how would you go about that? If you had a group of people, maybe it's a company, maybe it's a city, maybe it's a affinity group of everyone that has this common interest. How would you go about that?
Yeah. I think it's what's the future of insurance companies? What role do they play? What role does primary care play at the centerpiece of all this? And how do we create the incentives that are aligned versus the incentives we have today? We already talked about 2 or 3 where the incentives are just upside down, but there's many more. We got to fix that. So Any case, for another show, but it's been fun hanging out with you.
My book's called Elevate Health 2050.
All right.
Because I think it's going to take 25 years, I guess 24 years now, before we get it figured out. So
that's the calling card. We got to read the book. Read the book and come back and talk about it.
Yes, read the book, and then we can talk about it. But it's not going to be solved quickly. It's going to be an issue for several years, I think.
Yeah.
All right, Paul, thanks for doing this. Really appreciate it. Next week, we'll have Marcus back. And then, we should have a special show where we just like spitball new ideas, way to make healthcare what we all need.
I think it's going to take
necessarily great again, just a new system.
I think it's going to take diverging views coming together, right? It cannot be the Republicans coming up with this and the Democrats coming up with our plan. We're going to have to, it's going to take the smartest minds in this country to figure this out together. And I look forward to reading your book. And
if you take the opinion like I do that it's less expensive and it's the moral imperative to take care of the population either in the country or in your company, then you have to have some solution for health, wellness, diagnosis, preventative medicine, all those things we should spend money on, we should spend more money on. And somehow you need to pay for that.
Agree. All right, brother. Be well.
Yeah.
It's good talking to you.
All right.
Talk soon.
Okay.
Bye-bye.
Bye.